was given the task of having a discussion on developing a roadmap for improving access to anesthesia and critical care in Uganda. And in the spirit that was demonstrated earlier by Dr. Vulamba, I did edit and added the word quality for a given purpose. Access has been defined earlier. And our keynote speaker actually did give you different perspectives on access. And it is extremely important that we ask ourselves what we think access is. I do not, like earlier on, there isn't so much literature, but again, I'm going to ask that you bear with some of my opinions, which may not be very kind to some people. By the end, I'll have labeled this thing called the triskelion. And along the way, some may feel insulted when I use the word ignorant. Some may feel unhappy, but let's just remember that good things come in threes, and then try to label as we go along. Any good speech in Uganda starts with the word in 1925 or in 19-something. So, in 2016, someone took that picture, and you can clearly tell where it was taken. What do you see? This is not the geography picture interpretation. So some people are saying the World Congress. When I was scanning through pictures, I was shocked to see how significant this has become for AAU. So let's just try to imagine, we remove the two gentlemen in the middle. The rest are resident in Uganda. There is a glitch somewhere, but or else is the presidency of the association. Who took the picture? I can't even recall. I don't think it was an African. And you can correct the glitch if you so wish, because she still has the potential to become president. So, this is a roadmap for an association when it was right in its infancy. I came across this picture, this study that was published in 2016. And it was looking at access to safe care, anesthesia and surgical care in Zambia. Let's try and ignore any particulars that you see and concentrate on what it actually says. When they looked at safe access to essential surgical care, a lot of that country was covered. But when you introduce the idea of safety, then you can see that most of it is red. Over 80% of that population did not have access to safe, essential surgical care and safe anesthesia services. And ask myself, what is the picture in Uganda? Not much has been done. Someone called Kathleen Albert did a bit of work, but she did sample a few hospitals. And that is not as comprehensive as we would want to have. We need to go back and ask ourselves, where do we stand as a country in order for us to be able to address the issue of access to safe, to quality anesthesia services and critical care services. So, here comes my opinion. The government has been proud for a while, saying that every Ugandan lives within 5 kilometers of a health center. But we know that 5 kilometers is not 20 minutes, sometimes 5 kilometers, is 3 days, sometimes a month. And this is what we need to be asking ourselves. Where do we stand as a country? Do we have the smooth road that gets you to the quality anesthesia services? Or are you jumping into what Jose Mourinho termed a potato field? But that is much worse. Sometimes you may be in the ambulance and needs a push, or the breakdown that is dragging the ambulance needs a push. So, do you actually have access to the anesthesia services? This is the first point of ignorance. Our population. Do they know what we do? I keep asking myself every single time, if my grandmother were alive and she asked what I do, would I be able to explain what I do? So recently, a memo came out of the Ministry of Health written by the PS, and you can see it's labeled dated 29th September. And she's talking about the health units coming out to say exactly what they do, to tell the population what services are available. So here is my challenge. What are we doing as an association? What are we doing as individuals? We've been piggybacking on the Association of Surgeons of Uganda when it comes to the surgical landscape display. Are we able to go independent and actually be able to say something about it? This was at Kololo, the main picture, where, yes, we did set up a stall with one of our sponsors today, and it was quite successful because we had a section that had a critical care patient, and then we had the ICU. We did interact, but is this enough for each and every one of us? How have we leveraged technology to try and educate the public out there? So many times I would get WhatsApps and say, oh, you're on TV, when I was in my bed sleeping. It was because of that gentleman, okay, in the top right-hand corner. But I assure you, only I and the camera people know how long it takes and how many takes you have to attempt to get the term anesthesia mentioned correctly. We've had all different versions, anesthesia, that thing, sleep, and whatever. So it is challenging, and we need to change the narrative in all this. What can we do? At the end of the conference last year, or during the conference last year in Jinja, a group sat together and said, let's get involved. Let's go to the ANC clinics. And in the bottom right, I have a team in Mbarara that did this within that December. It was so popular, they said, come again. And they did it again. And this was interacting with the mothers and telling them about a cesarean section, what anesthesia does. And it is important, if each and every one of us left this place and said, I'm going to have one session in antenatal, so that we make a difference and educate. We need to leverage things like Twitter or X. It's still difficult to think about X, but there we go. We have to think about YouTube, Instagram. Can we have an X space to have a discussion? For those of you who remember, a while back, for World Anesthesia Day, we had a public engagement on Zoom. Unfortunately, I think the number was capped at 500, but people actually had a lot of relevant questions, including the misuse of anesthetics in robbing people. And they're asking, what are you doing about it? Here is the challenge again. How do we engage? Some people have made attempts, okay? So there is an Okelo with double L who has a status addressing patients and their tenants. And he does this on a regular. Very educative, but what is his reach? As an association, where is our TikTok that educates people? What have we done that has gone viral? Not that we haven't done anything, but is there something more we can do? For those of us who also can go back and say in 1925, okay, in 2010, Associate Professor, then still Dr. Kwizera, had a series of articles published in the New Vision and was explaining what happens in the perioperative period. There is a lot of ignorance out there that we can address as a nation. So, what can we do for that population? And what is our actual target? Because so far what we've tried has been for the elite, but we serve a majorly an elite population. Previously, I think the efforts of Dr. Bulamba also had that call line, for which people out there in the upcountry, stroke rural, were actually using to try and reach out to the people who know, or who know a little bit more, to try and give them directions when they were faced with very challenging cases. Unfortunately, well, the money ran out. But probably the Airtel at the time did not think anesthesia is important. Are we able to leverage that so that we try and engage more with the people practicing upcountry? If you drive, I think, about 80 kilometers out of the city, you start facing challenges with the internet. For those of you who are from the upcountry mice, these are challenges we know, okay? So the radio still holds key, and we have thousands and thousands of radio stations. What can we do about it? There are health talk shows. Have we been on them to educate and address the issue of ignorance? There is television. Whether you are in Uganda, Busoga, Lango, or whatever, there are television stations. And there are people here who think or who believe that they actually know the languages. Why don't we put them to task to explain what anesthesia and critical care are? These are opportunities to try and tell the people what anesthesia is, because if they don't know, then they will not be able to utilize the service. It's very important, as has been highlighted before, that we increase the numbers. I apologize for the quality of the picture. The iPhone 17 was yet to be made. But a lot of the people you see in that picture, the main picture, have either come here forward or they will come forward to try and tell you certain things. They've grown, they've been trained, and they're also training. And somewhere there, I also have the people who have put in so much, who have sacrificed so much for these programs to exist. We have to increase the numbers because they increase our voice. 113 anesthesiologists, 98 BSA anesthetic officers, and a few hundred assistant anesthetic officers just don't have the voice, the clout to make things move. We have to increase the numbers. And when we increase the numbers, then we are going to make a difference. We are going to have a voice that pushes for the change that we need. Of course, there are also other ways of increasing numbers. if you go home stressed and you are always unavailable, your children will never be anesthesiologists or anesthesia providers. So, different ways to grow the numbers. We have to think about continuous professional development. And there are so many ways to deliver this. This is based off of a self-obstetric course that was conducted in in Arua. It's extremely important that we think about the anesthesia provider out in the periphery. Because for some of them, ever since they left their training, they've not had opportunity to grow, to know what's current. So they become unsafe. In this place, we met someone who cannot read anything written on an ampule, but he provides anesthesia. So is that quality anesthesia service? We cannot leave them out there to hang. We've got to do something about it. We've got to think about mentorship because we've been mentored. Think about who you can take on as a mentee. Are you available to mentor? And Dr. Fred in the morning told us that very many are even willing to give up $2 million to just have a colleague. Okay? So that's a salary that someone could probably take on. So we need to think about that. We need to think about mental health. We need to think about burnout. That will be highlighted later on. Unfortunately, anesthesia training makes you think about the one case, the one patient you are interacting with that day, that patient with a fancy tumor, that patient with cystic fibrosis. And you think about all the resources that are going to that one patient. So you are making very important decisions that day and in that particular point in time that affect one person. One person. We need to rethink. I repeat, we need to rethink and start thinking about the million people, the billion people. Because the decisions in this country are made in terms of the millions, not in terms of the one individual, except one individual. Earlier on, I was telling people that it's difficult to recognize them outside of scrubs. My challenge this afternoon, is for you to don the ties. Suits are not made for you know who. Suits are, the people who've put on suits and whatever, some look very weird, but let's not highlight them. Let's start thinking about the fact that we've got to get into the decision-making spaces. We've got to get into the decision-making spaces. Because if we don't get there, then you never get anything. We've got to get to where the national portion is distributed. And ask for our cut. It's impossible for you to get anything on a silver platter. Not in this country. Not in the next probably 20 years. And this is, you must take it as the reality that it is. So you've got to be in the spaces where the decisions are made. In the hospital boardroom. On the hospital committees. You need to spare the time that gets you out of the OR, out of the critical care unit, where you are playing God, and get to the places where you have to fight for the resources that you need. You've got to ask yourself, who do I have to beg Who do I have to kneel before in order to get my cut? You need to know what policies push the things forward, and therefore be able to make the difference that you seek. And of course, if opportunity doesn't knock, build the door. There are some low-hanging fruits. I was looking at the essential medicines and health supplies list for Uganda. This is published in 2023. And I looked at the people who came up with this list. Guess how many anesthesia providers were there? Pardon? Can anyone stand up here and say I was part of it? Can we try and make the effort to write what we want next time? And it starts yesterday, not tomorrow. What is it that you want in the center that you are practicing in? At the national referral, at the regional referral, at the health center for? What is it that you want, and why do you want it? Because there is an opportunity to push for what we want. There are efforts that are going on to try and put guidelines in place, because without standard guidelines, or without guidelines, then we cannot establish what we think is quality anesthesia or critical care. And it's advanced to that level that the ministry is getting involved. But there are places that we can also leverage, because there are standards on medical equipment. How have we influenced them? Thanks be to God, I think the chair of that particular committee is an anesthesiologist, and that has made a difference. So some of the equipment that you are seeing is simply upgraded because the right people are in the right spaces. But again, as an association, we've got to ask ourselves, how have we enabled the people who influence policy to think about us? Have we groomed the leaders to reach those levels so that they're in the decision-making spaces? So as the standards come out, and when they get adopted, we've got to push, because you will now have a basis. With government support, they are saying, I must have ABCD. So it makes you push so that these things, so that the standards are not compromised. Partnerships and alliances have been extensively discussed. And we've got to ask ourselves, who aligns with our interests? Who aligns with our interests? What association aligns with our interests? What are we trading in order for them to get what they want? Because some are going to be thrown at you and you cannot resist. But what are you going to be able to get out of it? So we need to groom or to develop alliances and partnerships that advance our interests. What groups and what individuals are we going to align with in order to advance access to safe and critical care? So a journey of 1,000 miles starts with a single step. Those are not my words, but they hold true. And as an association, it's not that we've not done anything. It's just that there is always more that you can do. Someone said we spend our days waiting for the ideal path to appear in front of us. But what we forget is that paths are made by walking, not by waiting. My call is that you need to quit the waiting and start walking. We need to engage and educate the population to address ignorance. We need to increase the quality and number of anesthesia providers in this country. And we need to get into the decision-making spaces so that we influence the infrastructure, the medications, the numbers, if we are to make a difference. So my challenge to you is, what are you going to do about it? At the end of this conference, the question is, what are you going to do about it? Are you happy with the status quo? What role are you going to play? The critic? The gossiper? Will you be involved, or you are just a cheerleader? We need to depopulate the critics and get more people involved if we are to improve access to quality anesthesia services and critical care. I thank you for listening.